Schizophrenia affects 1 in 300 people worldwide. It is less common as many other mental disorders. The exact cause of schizophrenia is not known, but genetics, environmental factors, altered brain chemistry, etc. maybe play a role. Schizophrenia is a brain disorder which affects person's ability to think, feel, and behave clearly. Symptoms of schizophrenia are broadly classified into positive and negative. Positive means symptoms which is present in schizophrenia patients but not seen in normal people. Negative symptom means the characteristic or traits that is normally present in a person are negatively present in schizophrenic patients. For example, normal person would be sad when someone dies, but the same incident make happiness in schizophrenic patients. Positive symptoms are again classified into disorder of thought, disorder of perception, sense of self disorder. Let's see one by one. Let's see disorder of thought. In that, first one is delusion. You might have heard about the word delusion. It is a false fixed belief. The belief is false, but it is fixed. It is affecting a person's content of thought. They are believing something which is clearly false, but they are believing in that in a fixed manner. For example, somebody is thinking that I can control the whole world is under my control. Or somebody is thinking that I can hold a man in a string. Like that, they are believing. But it is not at all correct, but they are believing in a fixed manner. The false fixed belief delusions are of different types: grandiose, persecutory, somatic, delusion of reference, delusion of control, and nihilistic delusions. Let's see one by one the types of delusions. Grandiose delusions are the type of delusion in which the people would think that they are more powerful, rich, smart, or talented than they really are. In this figure, the man is thinking he is a king. They think that they have accomplished a greater thing than they have done. Persecutory delusions are paranoid delusions. Paranoid means doubt. They are doubting or believing that something or somebody is attempting to harm them or ill treating them or cheating them. These type of patients would think their wife or husband is cheating on them. Somatic delusions are delusions related to their body. They are thinking something wrong with all or part of their body. They believe that they have some type of general medical condition even though they are completely healthy. They would think they have cancer, they have stomach upset, like that. Delusion of reference also a paranoid type of delusion. He has doubt. All events in his surrounding has a special significance on him. Like that, he is doubting. For example, if he saw two people are talking in front of him, he would think, yeah, these people are talking about me. Or if he is watching a television show, an anchor is presenting something. In that situation, also, he would think, yeah, this anchor is talking about me. Delusion of control means a person is believing that all personal actions, impulses, or thoughts are controlled by an outside agency. Or they are thinking certain objects or person have a control over his or her behavior. Nihilistic delusions are the delusional belief of being dead, having lost one's own internal organs, or even not existing entirely as human being. In this, the individual has a false idea that they are dead, or part of self is missing, or internal organ is missing, or the world is non-existing. Like that, they are thinking. Under disorder of thought, we have completed delusions, types of delusions. Next thought disorder is associative looseness. In this, individual is shifting from one idea to another unrelated idea. Ideas shift from one unrelated subject to another. In this, they have a confusing speech. In this figure, you can see the individual is saying, I like to play games because the river is flowing down a mountain. The weather is sunny, the monkey has a long tail. Clearly, we can say there is no connection between his words. That is associative looseness. Neologism is the invention of new words by the person, by the psychotic person, which is meaningless to others but meaningful to the psychotic person who invents the new words. It may be invention of new word, usage or expression. Anything it is which is meaningful to him only, but it is meaningless to the other people. Clang association means people will combine unrelated words or phrases simply because they have similar sounds or rhyming sounds. For example, when I think of my dad, rad, mad, pad, sad, he is associating these words just because these are rhyming words. In word salad, people will use group of words without any logical connection. That's why it is called salad. But in clang association, they often take the form of rhyming. But in word salad, there is no logical connection, but they are put together these type of words. In circumstantiality, when we are asking a question, they will give a lot of unwanted, unnecessary details. That's why they will make a delay in answering our question. In tangentiality, the person never gets to the point of communication. In circumstantiality, after giving unnecessary details, finally they will reach to the answer. But in tangentiality, the person never gets the point of communication. People with mutism have an inability or refusal to speak. In perseveration, if we are asking different question, they will persistently repeat the same word or idea. So we have completed the thought disorder. So next heading under positive symptom is what? Disorder of perception. Disorder of perception include illusions and hallucination. So what is hallucination? You might have heard about the word hallucination. Hallucination is the false sensory perception. Problem is occurring with perception, but it is not associated with a real external stimuli. For example, they will see something which is not there, they will hear something which is not there, like that. There are different types of hallucinations. Auditory hallucination, that means hearing a sound that not exists. Visual hallucination, seeing a thing that is not exist. Gustatory hallucination. Gustatory means taste, so false perception of taste. Olfactory hallucinations. It is nothing but false perception of sense of smell. Tactile hallucination, which is the feeling of something moving inside the skin. These are the types of hallucinations. So we have completed hallucinations under positive symptom disorder of perception. Next perceptual disorder is illusions. In illusion there is real external stimulus. In hallucination there is no external stimulus, but in illusion there is a real external stimuli, but the pupil will misinterpret that stimuli. In this figure, by seeing this rope, people with illusion will perceive it as a snake. Under positive symptoms, we have covered thought disorders and disorders of perception. Next one is sense of self disorders. In that, first disorder is echolalia. Echolalia means client will repeat the same words that he or she hears. In this figure, you can see the child is saying, I want water. and the man is repeating the same word. I want water. That is echolalia. Next sense of self disorder is echopraxia. In this, the client purposelessly imitate movements made by others. Next sense of self disorder is depersonalization. Personality is changing, personality is losing, or they feel like detached from their thoughts, body, feelings, etc. They feel unreality, or they feel like their extremities have changed in size, or they think that they are living in a dream. So we learned positive symptoms. Negative symptoms we'll learn in the next part. Thank you. Thanks for watching Knowledge Masters. Please do like, share, and subscribe.